Hello, my name is Carolina Fleischman. Welcome back to my channel. Remember, this is a platform where I will not only be discussing the most prevalent and problematic skin concerns, but equally important, I will be discussing physical fitness and nutrition with the goal to ultimately create a healthier, more vibrant, and fulfilled lifestyle. Today, as part of my acne ongoing series, I will be discussing the subtleties between teenage acne and female adult acne, as well as treatment for both cases. Acne is a very common skin concern, if I would say the most common skin concern, among teenagers and adult females in their 20s, 30s, 40s, and beyond. It is very unlikely to see a woman that doesn't suffer from some form of acne. It is believed to be hereditary, so it needs to be treated proactively. So it makes sense then, if mom and dad suffer from acne, what I suggest for the parents to do is to treat it before they break out. It is never too young to treat a teenager. Remember, an acne lesion is the end of the process. Don't wait till they break out to treat it. Acne, it is all about prevention. And so you can treat it. I will give you, at the end of this video, stay with me. At the end of this video, I will give you the exact treatment for your teenagers. Now, acne has no cure, and it is an inflammatory disorder. And the process is the same for teenagers and adults, but there are some subtleties that are important to discuss in order to understand the differences in treatment. In teenagers, we like to refer to it as hormonal acne. It is and it isn't so, because about 2% of teenagers never get an acne lesion. So does that mean that they don't have any hormones and they cannot procreate? So it is more of a hereditary issue. And it is the same for adult and teenagers. And it has to do with the tendency of the cells sticking together. Now, in adults, in about 98% of adult females, it has to do with an interaction with free testosterone or a testosterone sensitivity. And it doesn't show up in the blood work because it is a wide range of normal. It begins like this. Inside the follicles, we have enzymes, which is perfectly normal. And we have these enzymes in our scalp. Outside the follicle, we have testosterone, estrogen, and progesterone. What happens is, as women, we have the same amount of testosterone as men, with the difference that ours is protein bound, which makes it, it is like having a sack around it, and that's why we don't get the divorce or the hairy chest. So what happens is, when we have this free testosterone and this a bit of testosterone sensitivity, the testosterone shakes hands with enzymes inside the follicle and they form dihydrotestosterone, which is the most aggressive type of testosterone, and it is instant acne. And it is usually in the perioral region, and it's in the form of mini cysts. And it is very hard to treat. They're very stubborn. Now, when it comes to the treatment, I always say there are no exceptions and no negotiations. Let's start with the female adult treatment. The number one thing, going back to the acne process, remember what's the beginning of the acne process. The acne process starts by the cells sticking together. So the number one thing we have to do is prevent the cells from sticking together. So we have to introduce something inside the follicle to prevent the cells from sticking together. So we need something that has very small molecules to penetrate, in order to penetrate the follicle. And a glycolic acid cleanser is just that. At its simplest level, glycolic acid dissolves and dislodges the glue-like substance or cellular cement inside the follicle, therefore preventing the beginning of the acne process. And what I recommend is a 12% glycolic acid wash with a pH of 3.25 to 3.5. And not only does it give you follicular cleansing, but it gives you, it does the same thing on the surface of the skin. It dissolves and dislodges the glue-like substance between the cells. You can buy the most expensive cleanser, but if the molecules are too large, you will not get the follicular cleansing that you need, because acne starts inside the follicle. So remember, a 12% glycolic acid wash of 3.25 to 3.5 pH. Now, the second thing you need is a retinoid, which is a vitamin A derivative. Now, we know that retinoids are the gold standard for acne. And what retinoids do, they actually change the environment inside the follicle. And what it does, it breaks the propensity of the cells. It interrupts the propensity of the cells sticking together by changing the environment inside the follicle. At the same time that you are de-aging, well, let me backtrack a little. Retinoids are not only the gold standard for acne, but they're the gold standard for anti-aging. So at the same time that you are treating your acne, you can de-age the skin. Number 3, remember, there are no exceptions and no negotiations. Number 3, let's backtrack to the acne process so you can understand why the need for P. acne bacteria, for benzoyl peroxide. Now, remember how P. acne bacteria gets inside the follicle where there's no oxygen and there are cells sticking together, and P. acne bacteria eats the oil and forms that corrosive byproduct that breaks the follicle wall and either creates a leak, a rupture, or a blowout. So what benzoyl peroxide does is benzoyl releases peroxide inside the follicle where it releases oxygen. P. acne bacteria cannot exist in an environment where there's oxygen. So it kills the P. acne bacteria colonies and it keeps them down. But remember, P. acne bacteria cannot be killed permanently. Otherwise, it would be considered bactericidal. But what we can do is bacteriostatic, which means killing it every day. You have to do it every day. And the one I recommend is a 10% micronized benzoyl peroxide. Now, the typical ones that you will find in the market, they are micronized to 60 microns. But there are some products that are 12 times more micronized. So that means it's down to 5 microns. And let me tell you why that is important. 5 microns, it bypasses the surface of the skin, therefore being less irritative, and it gets right where it needs to go, inside the follicle. So benzoyl peroxide, what you do at night is mix the benzoyl peroxide with your retinol and use it every night. So like I said, what you're doing is de-aging and treating the acne at the same time. Now, for adult females, I would like you to keep this in your back pocket. For all those females that have tried every treatment and they have not responded to any other form of treatment in their acne, what I suggest, and it's not me just suggesting, this has been used in Europe and in Latin America for many years for this purpose, is the use of spironolactone, which is not an antibiotic, it's a diuretic that has been used for decades for congestive heart failure and high blood pressure in much larger amounts. But the dosage that I suggest is 50 to 150 milligrams. Again, discuss it with your doctor. And what spironolactone does is, remember, in adult females, it has to do with the interaction of a free testosterone or a testosterone sensitivity, shaking hands with the enzymes inside the follicle. Spironolactone acts as a wall, and it prevents the testosterone from shaking hands with the enzyme, therefore not being able to form dihydrotestosterone, which is the most aggressive type of testosterone, and is immediate acne, like I said, in the perioral region, and those are those hard underneath the skin mini cysts. And 50 to 150 milligrams should be enough. We also have these enzymes outside the hair follicle. So it also helps with female pattern baldness. About 50% of women suffer from female uh, baldness. And this can really help uh, in the dosage of about 100 to 150. That's when it works for regrowth of hair. And it can be a miracle for some women that have tried so many different treatments, and they have not responded to it. So I would suggest that you would discuss this with your doctor. Like I said, it has started being used in Europe and in Latin America, but I have seen it more and more used for this purpose in the US. And there are virtually no side effects. Another thing that I suggest before I move on to treating teenage, and the same thing goes for teenagers, is not as spironolactone, but zinc. Zinc, 50 milligrams, 3 times a day. And what zinc does, it has been proven to be so effective for acne because it excretes an anti-inflammatory inside the follicle where the inflammation begins. And acne is an inflammatory disorder. So zinc, again, can be used for teenagers and adults. And let's move on to treating teenage acne. Now, we know that teenage acne tends to be hereditary. And so, mom and dad, it is never too early to start your teenagers to prevent it proactively. Don't wait till they break out, because that is the end of the acne process. And anybody that suffers from acne, especially kids, will tell you that it really affects their self-esteem among the peer pressure and and social media. So I would really suggest for you to start early. Don't be afraid. It is never too young. Prevent it. Let me tell you a story about a doctor who was actually, he dedicated his life to study acne because he had suffered from terrible acne, cystic acne, all his life. And he was afraid that his children would get acne. So he, since the age of 8, when puberty begins, he started treating his boy and girl with, I will tell you, with benzoyl peroxide wash and benzoyl peroxide leave-in. And they never suffered from acne. Now, for teenagers, I like to give them a simple and yet effective routine because they tend not to be too compliant if it is too difficult. And the goal is to make it so simple that they will do it every day like it's needed. What I recommend is a benzoyl peroxide wash, 10%, for both teenage girls and teenage boys, morning and night, and a benzoyl peroxide leave-in for 5% micronized for girls at night, and a benzoyl peroxide 10% micronized for boys. For boys it's higher because boys tend to be, the acne tends to be more aggressive. And if you need to, you can increase it to more, the leave-in, you can increase it to morning and night if needed. And don't forget zinc. Zinc, 50 milligrams, 3 times a day. It has proven to be so very effective for the treatment of acne. And please do not hesitate to reach out and if you have any questions regarding this discussion. All my information is in the description below, and I welcome you to visit my website where every month I have a free ebook for you to download, and this month happens to be all about acne, so you can download my free ebook about acne along with my blogs that give you further information. And please do not forget to like and subscribe. And if you would like to learn more about a certain subject, please write in the comments below. So in the meantime, remember, we are all a work in progress, and we all have something that we would like to improve upon. So be kind to yourself and others along the way. Stay healthy, happy, and keep smiling. Until the next time.